I think the biggest misperception about healthcare in the United States is that we have a market-driven system. We rely more on the private sector than any other country does in the world, any other advanced country. And so there's this notion that's been accepted both here and abroad that this is what a market-driven healthcare system would look like, what they have in the United States. When really that's nonsense. If the government is controlling half of the money, if it's giving employers control over another quarter of our healthcare dollar, so that the workers or the people who own or who earn the money don't own it, they don't get to control it. If you're a worker, if you're in Medicare, you have very little choice over what health plan you're going to use. That's not a market-driven system. And then you think about how the government tilts the playing field toward fee-for-service medicine as opposed to other ways of paying providers. And the way the government rewards or encourages a fragmented delivery system like Medicare does. If you look at the way that the government erects barriers to entry, each state government erects barriers to entry for health insurance plans or providers from other states. This is not a market-driven system. This is a system that has been slowly taken over by government, usually at the behest of some special interest or another. But the net result is that we have a healthcare sector that is as dominated by government as I would venture to say Canada's or Great Britain's. It's just that in the United States, the government makes different decisions with all of that power, and so we get a different set of bad outcomes. Instead of rationing by waiting, we get runaway costs and a lot of uninsured who are locked out of the system. And I think the key to solving both the problems of rationing medical care by waiting in other countries, runaway costs and the uninsured here in the United States, is to give individuals control over their healthcare dollars. Let them choose their health plans and let different health plans compete on a level playing field for those healthcare dollars. I think that that's how we're going to see improvements in both the quality and the cost of healthcare.